Well, this lecture will focus on what is deep neuromuscular block, how can you measure this, how can you achieve this, and indeed how can you reverse this. But far more important is, when do we need deep neuromuscular block? Is this for every patient, or are there some categories? Now, if you did listen already to my lecture on abdominal compliance, then you will have shown, or will have found already the ways to find these patients where the abdominal compliance is not big, and where deep neuromuscular block is one of the aspects to achieve and improve the laparoscopic workspace. And so that is already the first item. We will find these patients where we need a deep neuromuscular block in laparoscopy by measuring the abdominal compliance. But outside the laparoscopic procedure, there are also other surgeries where deep neuromuscular block is required. And by being there, the question is then how to return. And again, this will be determined by the surgical procedure, meaning that if the more time you have between the end of the requirement of deep neuromuscular block and the end of surgery, this will determine the way you can get this reversal. Spontaneous most of the time is not possible, because this is more than 1 or 2 hours, yet you will need, without giving any extra bolus dose. And then the question comes, when do we need actually sugammadex? When do we need neostigmine? And for which patient is this an absolute requirement? But most of all, you will learn that measuring the depth is the most important aspects, because this is the only way to achieve deep neuromuscular block, and this is also the only way to return from a deep neuromuscular block.